The federal government says it's not sparing any efforts in ensuring that the current spread of meningitis in the country is curtailed. To this end, the Director General, Center for Disease Control, Dr. Chikwe Ihekwazu, has announced that reactive vaccination for the disease is to commence tomorrow in Zamfara State, which has recorded the highest number of deaths. He was speaking at a meeting with the Senate Committee on Primary Health Care, where he asked the lawmakers to intervene in the area of providing access to vaccination.
About 6 weeks ago, when the situation started escalating in Zamfara State, we sent a team to Zamfara from NCDC who worked with our colleagues at MPACDA and the government of Zamfara State to analyze the data and then make an application to the World Health Organization to release some vaccines for us to respond. Those vaccines came in about 2 weeks ago. My colleagues will provide details on that effort, and the reactive vaccination campaign will start in Zamfara tomorrow, on Wednesday. In addition to the campaign my colleague will speak about that will start in Zamfara on Wednesday, there are also a lot of global efforts now to really push hard on advocacy to ensure that we are in a position to procure more vaccines. The technology to make these vaccines available internationally, the challenge is that it's very expensive, and therefore production is limited to those that can afford to buy. So I think, sir, there's a really big need for yourself to work with the Honorable Minister, who is very much aware of my visit, to raise our voices that it's not acceptable to be in this type of situation year after year. We will do our best again and learn from this outbreak, but the truth is we really need preventive vaccination to be available to Nigerians in order to deploy it before outbreaks happen, and not to wait till we can show that there's an outbreak of a certain level before we're allowed to apply for vaccines. It takes 1 month to come, and then we have to do all the micro-planning before we can deliver.